From baby's favorite blanket, the rubber ducky in the tub, a board book, the piece of fuzz on the rug, yesterday's cereals on the floor, mom's bedroom slippers, anything that crosses your baby's path will probably end up in your baby's mouth. King and queen, this process is called mouthing. It's a completely normal and important stage of early childhood development that most babies go through. Around 3 months of age, babies discover their hands and bring it to their mouths. Following this adorable revelation, starting from 5 months to 7 months, babies bring objects to their mouths.
Ready, go!
Why do babies put everything in their mouths? Number 1, it is how babies first learn about the world around them. They're using all of their senses to experience new things, which include the sense of taste. Believe it, King Dad and Queen Mom, babies putting things in their mouths also helps your baby's shiny new immune system to better recognize bacteria, viruses, and other germs that might get in. It helps them to prepare to fight off these invaders. In other words, the baby's immune systems are learning about what's out there and how to best protect his or her tiny bodies. Number 2, it provides a workout for the oral motor. Mouthing and eventually biting, chewing on things is how our tongue, lips, cheeks, and jaw first learn to move and coordinate with each other. It's also how the mouth muscles strengthen in preparation for eating food and making speech sounds when they're older. 3, it gets the baby's mouth used to experiencing different textures and sensations, which encourage the change to solid foods later on. 4, it's a way for babies to calm and self-smooth. Cutting a new tooth can be painful. Try giving your baby a teething ring that has been chilled in the fridge for some relief, etc. Safety precautions to take during the mouthing phase. Number 1, keep babies away from choking hazards like coins, marbles, toys with small parts, toys that can be compressed to fit entirely into a child's mouth, pen or marker cups, small balls, button batteries, medicines, hair barrettes and beads. In the food department, nuts and seeds. One easy way to check this out, kings and queen, is to make sure a toy or object can't fit through the opening of a toilet paper tube. Number 2, keep your baby under adult supervision so that they do not put harmful things in their mouth, especially outdoors. Take a few moments to do an inspection of your home at your child's eye level to identify any unsafe objects he may be tempted to put in his mouth. 3, to help prevent infection in babies, clean all the toys and objects that the baby is likely to put in his or her mouth. Ensure you clean the floors and all the surfaces your baby may touch. 4, positive reinforcement can play a major role in weaning the baby off the habit. If your baby tends to mount random objects, then substitute the harmful things with child-safe products and finger foods such as carrots and potato. This is if the baby is older than 10 months. Please note the baby must be older than 10 months. 5, for verbal and older babies, encourage them to understand the meaning of no. Gentle say no to them when they're putting things in their mouths. 6, teethers are a good choice for babies who are undergoing teething. Chewing on these toys will keep the baby at ease and prevent them from putting harmful things in their mouth. 7, pacifiers might help in keeping the babies calm while they're in mouthing phase. And we've been through pacifiers already, kings and queens. 8, keep all liquid and cosmetic like shampoo, detergent, lipstick, etc. away from the baby's reach to avoid any poisonous ingestion. 9, Keep the first aid box and the medicine away from the baby to avoid accidental ingestion. Number 10. And as usual, kings and queens, continue to clean baby mouth. Use a clean damp washcloth, a gauze pad, or a finger brush to gently wipe clean the first tooth and the front of the tongue after meals and at bedtime. Pediatric dentists prefer you use toothbrushes moistened with water and no more than a rice grain size smear of fluoride toothpaste. How long the mouthing chewing stage lasts. Kings and queens. The baby is likely to go on putting things in his or her mouth well into her second year. However, by 9 months to 10 months, she will start to use her hands or his hands more. By 12 months, he or she will become increasingly interested in what his or her toys can do. By the time the baby is 2 years old, he or she will use his or her fingers to explore most of the time. And by the age of 3, most children have stopped putting objects in their mouths. This is different for each child though. Sometimes kids will keep putting things in their mouths until after they stop teething, or sometimes they will stop and then start again once teething starts. Putting things to the gum can be very soothing when new teeth are trying to come out. It really depends on the child. So follow the lead. Give them a teether whenever necessary and enjoy this special time because they always grow up too fast. There we go, kings and queens. Have a blessed time as we all learn about mouthing.